In the first few weeks, what we're trying to do is just introduce all the different tastes to babies. So the first thing to be aware of is that babies do have a really small stomach and that their appetite does vary. Over the course of a couple of weeks, it would be introducing a new vegetable every day. Be careful about using the dummy or pacifier too much. So overall, all the different spices are very beneficial for the gut microbiota. So if you give a range of spices, you're going to help that diversity of the gut bacteria. Fats are really important, particularly for babies' brain development, for their nervous system development, and actually the messier the better. So if they can get both of their hands into the bowl, that's actually a good thing. And really it's a case of understanding when they're hungry, but also understanding when they seem to be full and satisfied.
Please subscribe to Unii's channel for more exciting podcasts. Hello everyone, and welcome to the Unii podcast with me, your host, Dr. Saranya. Today I'll be speaking to Unii expert Dr. Venita Patel, who worked on the Baby Nutrition Journey with us. Venita is a community paediatrician and registered nutritional therapist with a particular interest in childhood growth and development. In this episode, we'll address some of your most frequently asked questions about breastfeeding, baby gut health, and weaning.
Welcome to the fascinating world of baby nutrition. During the early years of a child's life, their little brains and bodies are growing rapidly, and the nutrients they receive play a vital role in supporting this development. Proper nutrition ensures that babies get the essential vitamins, minerals, and other nutrients they need to build a strong immune system, develop healthy bones and muscles, and achieve optimal cognitive function. My name is Dr. Venita Patel, and I'm an experienced NHS paediatrician and registered nutritional therapist. In this journey, we'll cover a whole range of information from the nutrients your baby needs and how to introduce solid foods, to managing feeding schedules and addressing any nutritional concerns. So, whenever you're ready to begin, check out the first episode down below.
Welcome, Venita. I'm so delighted to have you here with us today.
Thank you. Lovely to meet you, Saranya.
Nice to meet you too. Now, as you can tell, I'll be feeding my own little one very soon, and I've really been looking forward today to hearing all your expertise about baby nutrition and some of those unanswered questions. But one of the most interesting things about meeting other doctors on this podcast, especially paediatricians, is understanding how your day-to-day differs from my own, and also your motivations for pursuing a career in paediatrics. So could you tell me about a typical day at work?
So a typical day in my NHS work usually involves clinics where we have a long time with our families, which is wonderful. So we have at least an hour spent with children and families, and those could be developmental clinics quite commonly. And then we have meetings, so we're doing things to talk about the health of the wider population. And one of my interests is in childhood obesity, so I run clinics with other professionals working with dietitians and fitness specialists to help children who have a high BMI. And then in my nutritional therapy clinics, again, I get to spend a long time with families, so even over an hour. And that could be face-to-face or on video. And I really look at them in a holistic way. So it's lovely to be able to think about them in terms of their nutrition, but also about their whole health and how it relates to what they're presenting with. So both sides are really enjoyable, and I'm enjoying the mix of both of them as well.
And it sounds like they really complement each other very well. There's lots of overlap too.
Definitely. Yeah.
And what was it that initially drove you to become a developmental paediatrician?
So I met someone who was working as a community consultant when I was a very junior trainee, and at the time I was kind of enticed by exciting hospital medicine, but they were explaining to me how you're actually helping a wider population, not just one-to-one, and really inspired me to work in the community because they were working in other countries, and that's something else that I wanted to do as well.
And what about becoming a nutritional therapist? What drove you to do that?
So I always had an interest in nutrition growing up, which was a kind of family interest. And then when I got the opportunity to train, I realised that there isn't a pathway for children's nutrition. So I kind of waited, and then it just happened that I had some time off from work, and a friend had been studying nutritional therapy, and it just grabbed my interest immediately. So I realised that there is actually so much science behind all the kind of healthy things that we talk about. So it was fascinating.
It definitely is a fascinating area. And can you, for our listeners, just clarify the differences or possibly the similarities between being a dietitian, a nutritionist and a nutritional therapist?
Yeah, so there is a lot of confusion over those terms. Essentially, dietitians are the ones you meet in the NHS. So they specialise in different aspects of health and how your diet needs to change, something like a person with a kidney problem or diabetes, and they'll guide you specifically on what you need to do for that. A nutritional therapist would be looking at the underlying reason for something that you're presenting with, so any chronic symptom, and seeing whether there are any nutritional deficiencies, biochemical differences, and even genetic issues, which can be addressed, looking at the root cause rather than just giving a sort of superficial answer to that. And then nutritionists are often working in industry. They can do clinical nutrition work. And they are trained to look at guidelines, so they will often work with companies or in industry.
And do you necessarily have to be a doctor to be a nutritional therapist?
No, you don't. So other people can do the 3 or 4 year diploma, which also is a degree now. And so I didn't have to do the full course because I already had that knowledge.
And as a paediatrician myself and expecting a baby, I am aware of how my perspective is shifting a little bit at work, the way, especially I deal with new mums and newborn babies. And I'm just wondering whether there's anything specific that you learnt from having your own children and being a paediatrician or a nutritional therapist.
Absolutely. I always say that I was a different doctor after having my own children. As you say, you do think differently when it comes to your turn to going through these things. And one of the first things that I was thinking about was having a birth, because as paediatricians we often see births which haven't gone to plan. And so I was looking at more kind of natural options like nutrition and yoga at that time. And then after having my children, they really taught me about the living with a child experience. So what does it mean to be up all night with an unwell child? I knew what that meant after having done it. So I think that really helped me to feel empathy for families that I was seeing and understand what they're going through.
And I think I'd agree that that's kind of where I'm shifting towards as well now. So what are some of the common questions that you hear at work about baby nutrition?
So in my nutritional therapy clinic, I do get quite a few referrals for babies who have, say, colic or abdominal pain, and that might be related to constipation. And then the other issues are commonly presenting things like reflux or just excess vomiting. So because I take a holistic approach, so a whole person approach, I'm looking at all the aspects of the baby. So I'm also going to be asking what the mother is eating and drinking if she's breastfeeding. I'll be asking about their whole routine, so in terms of baby sleeping, and then thinking about how to address it in terms of, are there any issues which are obvious? So sometimes mothers are eating something which is causing extra gas in the baby. And then apart from that, there are other areas that you can help a baby. So you can do things like a tummy massage, you can do a bath with some Epsom salts, and those can contribute to helping the baby. So you're not just looking at the tummy and thinking what can I give in terms of a medication. You're thinking of them as a whole.
That's really interesting, and I think important to remember that it's not just about one particular area. Everything feeds in, and that's great that you consider all of those things together.
Definitely.
Now, there are a lot of government-led initiatives and information out there in the UK as well as internationally. If I made you a world leader for a day, is there any one area regarding baby nutrition that you'd like there to be more information about?
I think that there is a lot of information, but the question is that when it comes to your own child, where are you going to get that information, and how are you going to work out what applies to you? So I feel that it should be more available to people to have someone to ask, because we used to grow up in a community where you could ask your grandmother or your aunt, and we've kind of lost that village. And so I think creating some sort of village, which we do have health visitors, but they are now few and far between. So someone perhaps in the middle who is an experienced mother who could support another person. I think that would be a valuable thing to do.
Like a peer support system.
Definitely, yeah.
Yeah, that sounds like a great idea. So let's talk about those first 1,000 days of a baby's life. Can you tell us why those first 1,000 days, especially in terms of nutrition and development, are so important?
So the first 1,000 days actually begins from conception. So initially it would be about the mother's health, the mother's nutrition, but our focus is on babies. So once the baby is born, then we're going to be thinking about how the baby is being fed, and then the next stage would be at weaning, where you're going to be introducing foods. So that's the next big kind of change that happens in a baby's life, up to 1,000 days, which is roughly the age of 2. So obviously there are many changes which are going to happen over the course of that time. And one of the key areas which it influences is the baby's gut health, which we're really just beginning to discover, and it's one of the most researched areas at the moment.
And something that I actually don't feel like I know that much about, so this is fantastic because I'm learning so much from you. And I suppose I probably know the answer to this question, but what would you say is the best source of nutrition for my baby?
So we will say that breastfeeding is the best source, but we are fully aware that not everybody is able to breastfeed and that there are many other options.
And what sort of initiatives have you participated in that help support or promote breastfeeding?
So the WHO has kind of a worldwide initiative, and my work in India, we have people who are like midwives, but they're also doulas, and they support the women after birth. So I did some work with them in terms of how to help women and support them in that period to be able to breastfeed successfully.
Wow, that's so rewarding and also very interesting. So let's talk about the connection between a baby's gut health, overall well-being, and the mode of feeding.
Right. So obviously at birth there are 2 options really. So breastfeeding is one option, and then if that's not possible, then we have different formulae that are available. And we know that there are differences in the way that the gut microbiome or gut microbiota develop. So when you have a breastfed baby, there are slight differences in terms of the bacteria which you see, and also the speed of which the bacteria accumulate compared to a bottle-fed baby.
Oh wow, that's interesting. I didn't realise there was a difference. And a term that many of our users may have heard but not know much about is oligosaccharides. Can you tell us why those are important?
So in breast milk we have these products which are actually the fuel for bacteria, and they are produced in abundance in breast milk, particularly in the early days, and so they are helping to set up the gut microbiome in the baby, which is accumulated in different ways depending on also how the baby is born.
And does that mean that those are absent in formula milk?
So the formula milks are very clever now, and we've been able to add those into formula milk so that they're not absent. We are able to give those. But there are other differences which can influence the gut microbiome.
That's really helpful to know. So I'm approaching the end of my pregnancy now, and I'm thinking more about the mode of delivery, specifically the fact that I may end up having a caesarean section. Is there a difference between a baby's gut microbiota depending on which kind of delivery I go through?
So they have shown that there's a difference. Essentially, when the baby comes through the vaginal tract, they're accumulating the bacteria from the maternal tract. And that's the first kind of inoculation or ingestion of bacteria which goes into the baby's gut. And obviously through a caesarean section, we miss out on that process. So the bacteria which are found in the gut tend to come from the environment. So if it's in a hospital, which usually a caesarean section would be, that is possibly hospital bacteria which are around in the environment, but also the bacteria that are on the skin. So those are the bacteria that we would see first. So it is just a different type of accumulation of bacteria and different strains that are seen.
And something that I've learned from you about is symbiotics. Are you able to tell us a bit more about how they work, and specifically in the C-section born babies, how they might be helpful?
So symbiotic basically is a combination of a prebiotic and a probiotic. So a prebiotic is the fibre which feeds the bacteria. So it's essentially the food for the bacteria, whereas a probiotic is the actual bacteria. And so what we've found is if you're giving one or other on their own, it works better to actually give them together. So this could be given to the mother, that could be given before birth as well. And then if there is an indication, it could be given to the baby as well. So usually I would say to be guided by someone who has experience in advising on these things. So nutritional therapists are trained in this. But if you wanted to, there's plenty of information that's available. You can ask a pharmacist because there are some things which they're trained in as well.
And you mentioned about having these symbiotics during the pregnancy.
Yeah.
I've read about taking probiotics and that reducing the risk of mastitis. Can you tell us how that works?
So they have done some studies to look both at prevention of mastitis, but also trying to reduce the recurrence of mastitis. And they found that certain strains which are taken can actually influence that. So it's not something that's widely known. It's not something that midwives are currently advising on, but I feel that there will be enough evidence soon for people to be guided on that.
And are there any other benefits of probiotics in pregnancy?
So particularly if you've had antibiotics or if you might need antibiotics. So some people at birth have an indication for needing antibiotics, and in that case it would be useful to be given probiotics or to take probiotics. But I have to say we can also guide parents or mothers to take probiotic foods because they also play a role in how the gut microbiota changes.
And is that something that has to be prescribed, or can you get that over the counter?
So probiotics can be over the counter, but there are so many, so it can be confusing for people. So again, I would say to ask someone to advise you on that. But there generally are broad range ones which most people can take. And then probiotic foods, there's no kind of restriction on taking those. So that's something that I tell people to do more of.
And you mentioned that you could ask a pharmacist for help with where to go for symbiotics. This is still quite a new field.
Yes.
And where would you suggest people get more information about that?
So there are certain websites which are showing the research. So if you're that way inclined, then there are particular websites that you can look at. But I think generally the advice isn't out there yet, so which is why I usually say to ask a professional who has some training.
So moving on to weaning to solids, something I'm asked a lot, which I'm sure you are too, is when should I start introducing solids to my baby?
Yeah.
Should we stick to the 6-month target, even if your baby is showing signs of wanting to wean earlier?
So we talk about the signs of readiness for weaning, and some babies obviously are going to be early developers and will show all of those signs Generally, it is around the 5 to 6 months. But if you have someone who isn't sure, then you would say to wait until 6 months. It doesn't cause any detriment to the baby if you're waiting until 6 months.
And I think something that's probably a bit more widely known about is allergies, especially to some of those common foods like eggs and milk. And there's a suggestion that possibly you wait a bit longer to introduce those, or that they should be introduced earlier. And I think there's a little bit of confusion there. What would you normally advise about those?
Yes, so there is a big area of allergies which people are becoming more aware of, and they are becoming more common. And actually the research shows that by introducing allergens earlier, that can prevent future severe allergies. So we're guided to introduce allergens individually and to wait a few days just to see if there's any reaction, just to be on the safe side. So that's the current guidance which most people are able to follow.
And what are those signs that parents should be looking out for?
So if you see any signs like a rash, or if you feel that the child is distressed in any way, those could be signs that they're beginning to have an allergic response. There could be more obvious signs, so sometimes you do see babies who go into having breathing problems, you can hear a wheeze, but usually it begins more mildly, so it's usually beginning with a rash and maybe some swelling.
And if a parent or a sibling has any allergies to a specific substance, are you more likely to then have another baby with the same allergies?
So there is some link in terms of genetics, but even in those cases they are guided to introduce allergens early because that can prevent their child having the same problem that they have.
So let's talk about babies' first meals, because this can be quite an exciting time, but of course as adults, where we can eat anything we want, there seems to be quite a lot of worry about giving your baby the right thing. Is there any specific food you would recommend to start off with, or something that you use in your own children that you'd recommend?
Definitely. So in the first few weeks, what we're trying to do is just introduce all the different tastes to babies. So they're not really going to get lots of nutrition, but they're going to be exposed to all the different flavours. And the evidence shows that the earlier you introduce all the different flavours, the more likely they're going to accept them as their taste preference, is what it's called. And so that includes all the bitter vegetables, things like broccoli and spinach, and all the ones that we think baby might not like. And what happens is that baby usually takes a taste and then makes a face because they've never tasted that before. And to us it looks like they may not like it, so they may make a face that looks like, oh, what was that? But actually that's just their reaction to say, I haven't experienced this before. So we shouldn't be put off and say we're not going to give that food again. So really over the course of a couple of weeks, it would be introducing a new vegetable every day, and beginning with the more savoury vegetables is actually better because you then allow baby to experience those first, because we know that most babies love the taste of sweet foods anyway.
That's really helpful, especially about the face that you mentioned. I've definitely seen that in friends' babies and wondered, does that mean this one is immediately eliminated? But I guess it's about being patient and keep persevering with some of these. So let's talk about some specific foods and areas of nutrition. So iron is something that's recommended as beneficial in the diet, but sometimes is associated with difficulty in digesting that particular substance. How can we introduce iron into our babies' diets?
So we are going to be thinking about all the vegetables which include iron, and one way to help absorb iron is to give some vitamin C with it. So generally giving something like a fruit, and naturally some pairings work. So something like spinach, if you're giving with a bit of tomato, you're then going to get both the iron and the vitamin C together. When it comes to meat, that can be slightly harder to digest and absorb, but actually most of the time initially you're going to be blending those foods, so they're more easy to extract the iron from.
And you mentioned about meat. Is there a specific age that you would want to introduce those?
So people do introduce it fairly early because now we're weaning at 6 months, whereas perhaps our grandparents or even older parents introduce foods at 4 months, you would wait until 6 months to introduce meats and fish.
And talking about fish, is there any particular considerations that you need to think about? I know during pregnancy, I was quite careful about certain fish types because of the metal content. Is that the same for babies?
So it is something that we should be aware of, and generally we would say just to give 2 or maybe 3 portions of fish in a week. And if you are keeping to the smaller fish, then you're going to eliminate the worry about having extra things like mercury in the fish, because the smaller fish also are beneficial in terms of their omega-3 content, which is really important for babies' brains.
That's really helpful. In terms of vegetarians and vegans, it's something that's definitely more common nowadays.
Yeah.
How can families who are vegetarian or vegan ensure their baby's getting the right number of, or the right amount of protein and nutrients in their diet?
So I think for vegetarians, it's not such a worry because you do have good sources of protein from dairy. And also if you eat eggs, obviously there's a multi-nutrient in eggs, so it contains all the possible things which are needed at that stage. When it comes to vegan, it's a little more difficult, but it is very possible. And really, I would say that you do need to do your research to make sure that you're getting in the foods which contain calcium, and you're also ensuring that they're getting a wide range of vegetable proteins. But it doesn't usually cause an issue if you're making sure that those 2 areas are thought about.
Okay. And in terms of cow's milk, something I get asked about is whether it's okay to introduce cow's milk before the age of 1. How would you advise on that?
So generally we would say not to give cow's milk as a drink until the age of 1, because if you give excess cow's milk, you can then have iron deficiency plus other issues. But if you're using it in cooking, so if you're making a sauce or something which requires milk to be warmed, or you can add it to mix into a porridge or a cereal, then there's no problem with that.
So it's more about the proportion of the milk in your diet. Okay. And fruits and vegetables, obviously there's many to choose from. Are there any specifics that are better than others, or any that you should avoid?
So generally I guide people to say eat seasonally, because those tend to have more nutrients and they are more suitable for the time of year. So for example, currently we have all the winter vegetables which have lots of vitamin A, which is good for our immunity. So there's a reason why seasonal vegetables are better for you. But if not, then there's also frozen vegetables which contain much more in terms of the nutrients because they're frozen at source. So don't be worried about using some frozen vegetables. And then just thinking about variety, so having as much variety and diversity as possible.
And whilst you're talking about variety and diversity, we've heard about this strong drive for your 5 a day. How do you make sure that your baby is getting enough in their meals?
So I do find that families are very good at giving their babies lots of fruits and vegetables, particularly because babies love their fruit generally, and that it's actually when they're a bit older that it becomes harder because sometimes they go through the fussy eating stage, usually around the age of 18 months to 2 years. So initially I find that people are giving at least 5 or 6 a day, but it's later on that they're saying, they've gone off broccoli or something that they used to love.
And what about the skin on vegetables and fruits, whilst we're talking about them? Is it essential to peel your fruits and vegetables? Because I know as an adult, I make sure I eat as many of those as possible because I know that's where the nutrition lies. Is there another way of introducing those into baby's food if you can't use those?
So most things don't need to be peeled. Obviously for safety reasons we say things like grapes, we should peel them because babies don't have the ability to chew. So if it's a peel that's too hard for them to break down, then for a safety reason we wouldn't give it. But otherwise I would say don't peel too many things, just give them a good wash. And if you're steaming, that's going to break down the skin anyway. So it's not really a big problem for babies.
And is there any benefit in making these foods yourself at home? versus buying them from the shop?
So we would always say that homemade is best because you know what's going into your food. It's also, in the long run, works out cheaper for people, and generally you can adapt it to your diet. So if your family tends to eat foods which are, say, spicier, you can add spices into your baby's diet, whereas you're a bit restricted then if you're buying things to what the ingredients are, and also then it does lose some of the nutrients.
I think we have to appreciate that realistically, I'm not going to be able to make homemade baby food all the time. And there are some really convenient store-bought options.
Yes.
What should myself and my partner and parents be looking for specifically in the shop-bought options?
So I would say that most of the commercial baby foods, they do follow the guidelines in terms of things like added salt, added sugar. They tend to be very good about those. What is less clear is how much in terms of nutrients are still available in the foods. So what I do say is if you can give something fresh at the same time as giving the baby food, the baby bottled food or commercial food, then you're going to be adding extra nutrients in. So even if it's just having some fruit as a dessert, then you're going to be just adding some fresh nutrients in.
That's a really helpful way to kind of get the best
Balance.
of both. And you mentioned about the different types of baby food that's available, and I know, having seen it myself, there's organic versus conventional.
Yes.
Is there a specific benefit in using one over the other?
So they would say that organic has slightly more in terms of nutrients, but I think by the time you've processed vegetables and meats and other foods into these foods, there's probably not much difference. So I wouldn't worry too much. Unless you're fully reliant on buying the foods, then you might think about having more of the organic foods.
That's really helpful to know, because obviously it's one thing that you might worry about more if you don't have much time to make those things at home. So you touched on the salt and sugar content of some of those store-bought options.
Yeah.
Let's talk about salt and sugar in the diet. Is there a restriction on how much our babies should be getting?
So definitely under 1, I would say don't add any salt to food, and if you can help it, don't add any sugar. Generally, if you have the sweetness from fruit, then you don't need to add sugar. And in terms of salt, you can use lots of other spices. So you can use things like onion, garlic, and the non-chili spices. So all the other spices can be given, which flavour the food. And then after 1, you can use a little bit of salt, but it may still not be necessary.
That's what I was going to ask you about. So coming from a Sri Lankan family, we are keen to introduce our baby as early as possible to some of those spices. It seems bizarre to introduce them without salt, but I appreciate that's a particular consideration. But it sounds like most of those are safe to give, apart from chili.
Well, they are all safe to give, but most babies wouldn't want to tolerate the chili. But all the others actually have some good health benefits as well.
So you mentioned that there are benefits in having spices in your diet. Can you tell us a bit more about those?
So overall, all the different spices are very beneficial for the gut microbiota. So if you give a range of spices, you're going to help that diversity of the gut bacteria, which again are going to be helpful for baby. Then there are specific benefits. So there's one which has been mostly studied, which is turmeric. And some of the compounds in turmeric have been shown to reduce any bacteria in the gut which we don't want, but it also has an anti-inflammatory effect and supports the immune system. So babies who might be exposed to viruses, that can give their immune system support. Wow,
so there are some natural supplements in your diet that can help support your immune system. That's really good to know. And turmeric's definitely something that's included in my traditional diet.
That's
so
great.
That would be perfect. And let's talk about the specific textures. So you mentioned introducing a variety of foods to the baby to get them used to all of those different things. And I know personally I've encouraged parents to introduce different textures to help with their mouth development. Can you tell us a bit more about how the textures can be helpful, or if there are any that you should avoid?
Yeah, so when you're weaning at 6 months, babies are actually quite good at breaking down soft foods. So you don't need to make very smooth purees, even at the early stages, even though some people do prefer to do that. And then you can progress quite quickly onto mashed textures rather than having to use any blender. At the same time, you want to introduce baby to feeling things. So it's not just that they're feeling the textures with their mouth, but they're also feeling things with their hands. So what people like to do is when they're giving a puree or mashed version of something like cauliflower, they would give the baby a piece of soft cauliflower in their hand so that they're sort of aware that this is what the vegetable is, and they can feel that has a different texture as well. And then as they get a bit more used to having foods in their mouth and moving foods around their mouth, then you can actually progress on to giving them what we call finger foods. So you're giving more of those soft things in their hand, which they then put in their mouth themselves. And that helps their gum development, and then also the back of the teeth. The whole process, including the tongue, helps actually their speech development.
Wow, that's so interesting. It's like the weaning process is also kind of a holistic process where you need to be thinking about all those senses working together.
Yeah, helps their development.
That's great.
Overall.
So in pregnancy, I've been taking supplements, obviously, to help with the growth and development of my baby. I know that there is also a role for supplements in babies.
Yes.
Can you tell us a bit more about those?
So particularly in some countries, there is a lack of sunlight, so we do need to supplement vitamin D. So this is more for the breastfed babies because they do actually add certain vitamins to formula milk. So they tend to have enough of the vitamins from formula milk. So it's really breastfed babies, and then you're thinking about whether they're going to get other things through their diet. So for the first 6 months, really vitamin D on its own is okay. After that, we would be thinking about all the other vitamins and minerals, and it depends on the diet whether you need to add many of those in.
And how would you know if you would need to have supplements or not?
So I would say if you're going to bring your baby up on a vegan diet, then you would be thinking about adding in certain supplements, because we can't get things like B12 from a vegan diet naturally. So you would think about supplementing that. And you possibly would think about omega-3 and zinc as well. But I would say to ask someone who's trained to guide you on those.
And we've been talking about the positive experience of getting our babies used to solid foods. But of course, there is going to be a time where your baby just will not take what you want to give them. How do you advise parents to deal with food refusal?
So the first thing to be aware of is that babies do have a really small stomach, and that their appetite does vary. So it varies from day to day, but also it varies depending on whether they're unwell or whether they've done a lot of activity or movement that day. So just to be aware that appetites for babies are not going to remain the same. So one day they might have a fairly good portion, and the next day they might not want to have any of it at all. And then as they get a bit older, that's when they tend to refuse on the basis of what something tastes like, but also on what it looks like. So there's the developmental stage which comes in.
And many of us will use dummies or pacifiers as part of our baby's routine. Is there any impact on using those with the weaning process and baby nutrition?
So what I would say is to be careful about using the dummy or pacifier too much, because it can affect how the mouth develops, and also it affects how their speech develops, but that's another subject. So in terms of using a dummy or a pacifier, usually under 6 months, it doesn't cause too much of an issue. And it's only really once they're weaning that you would say that we want to help the full mouth development and avoid just having that sucking motion too often in the day.
So I suppose we could use that phrase weaning as also trying to wean out
You
the
could.
dummy or pacifier once you're introducing those
possible.
solids. And something that we've heard a lot about in our uni journeys and also through the podcast is how most things to do with babies involve a routine or a schedule.
Yeah.
Now, that can be quite stressful sometimes because if everything is about a routine, you can become quite fixated. Is it important to have a routine for your baby's nutrition also, or should you just be led by their cues?
So generally I would say to have an outline of a routine, but if that doesn't work every day, that's fine. And actually it depends on the family and the parent, how they parent. So if it suits you to have a more fixed routine, then that's fine. But it doesn't really suit everybody. And as you said, it can sometimes cause more stress than be helpful. So to think about, yes, baby does need a certain number of meals and bottles as well, or feeds in between, but not to worry too much if that feed happened, say, half an hour later or something didn't happen that day that you wanted it to, because generally the next day they'll be back in their normal routine and you shouldn't worry too much if 1 or 2 days don't go to plan.
And if we're all sitting round the table to have our meals, breakfast, lunch and dinner, is it important to also include the baby in that particular time so that it becomes a family event rather than feeding your baby separate to those?
Yeah, so the family meal is a really useful and helpful way to introduce babies to different foods, because they may be smelling what you're eating, they may be looking at what you're eating, and then that gives them an exposure to that food, and they're more likely to have a wider variety of preferences when you do that. But also it's the social aspect of eating, so they understand that actually eating is done in a social manner and that it involves people talking and enjoying themselves and being relaxed.
I wanted to ask you, we've had a lot of information, we've discussed a lot of areas, but when is it and where is it that parents can seek professional help to do with baby nutrition?
So the first port of call would be to go to your GP, and then they can refer you to someone like a dietitian if there is a concern. So quite often parents have concerns about their baby's growth, and there are health visitors in this country who can monitor baby's growth. In other places it would be your doctor. If there's a concern about that, then they can refer you to a dietitian. If there's more of a concern, then they can refer you to a child health specialist or a paediatrician.
So something I hear about a lot is baby-led weaning, and I'm curious to know a bit more about that. What is it and how does it work?
So baby-led weaning is an approach to weaning which some people like to adopt, and essentially you're guided by your baby in terms of what they want to eat. So you would offer them a range of foods and then they would choose what they want to eat, and you would tend to offer a mix of foods which they can pick up and then also some foods which they could take from a spoon. So you're not feeding them.
Okay, so it's led by the baby, as it suggests.
Yeah.
So what you're saying is that it's, as it says on the tin, led by the baby. But what are some of the pros and cons of doing it that way?
So one of the reasons that people might not like this method is because they feel they're not able to assess how much their baby is eating, and also because the baby may be choosing, they might not choose the foods that they want them to eat. But generally, if you're offering a wide range of foods, then they will tend to take some of all of those. And you're looking at it over the course of, say, a week or a couple of weeks. So you're not worrying on one day that they didn't have lots of vegetables. You're really kind of judging it over a longer term. And then the pros are actually that helps their development because they are reaching for foods and putting them in their mouth. So they're using their hand-eye coordination. They're also feeling the food a lot more. So their sensory exposure to food is increased. And that tends to help them to avoid basically the kind of fussy eating stage where they don't want to touch certain textures or they don't want to eat certain flavours.
Okay, that's really helpful. So I often get asked about introducing water into a baby's diet, especially in those hot summer months where we're reliant on water ourselves, and it seems strange that the baby is not also having any of that. How do you advise parents on water in the diet?
So generally babies are able to have extra breastfeeds if they need to have extra fluid, and that tends to cover their fluid requirements. If they're formula fed, it can be slightly different, so you might then want to think about giving an extra formula feed, or you might want to give a diluted formula feed. But generally you can cover their requirements within that. You don't need to give extra water by itself. It's different when they start to wean. You might want to give a little bit of extra water then.
And is there a specific amount that we should be giving?
So not really a specific amount, but the guidance is to offer a small beaker which they can have at the same time as eating.
And does it matter the temperature of the water?
Generally, you wouldn't want to give too cold water, so room temperature is ideal for babies, under 1 especially.
Okay, great. Can you tell us a bit about healthy fats in the diet?
So fats are really important, particularly for babies' brain development, for their nervous system development, and we want to include fats which are healthy. So that would mean thinking about all the fats that you cook with. So we would focus on cooking with something like olive oil, and then also the fats that you're including on the plate. So we would think about things like avocado. We would also think about having pureed or butters, so that would be nut butters or seed butters, which is a good way to introduce nuts to babies. And then last but not least is the omega-3 food, so oily fish particularly. And that's something that you would be gradually introducing because they do tend to have a stronger flavour.
And if your baby's not having those stronger flavours, should omega-3 be supplemented?
So we actually do get omega-3 from breast milk, and some of the formula milks do supplement with omega-3 as well. So you may not need to give any omega-3 supplement unless they're not having much in terms of breast milk or formula milk. And then you would be seeing what is coming through the diet. But there are plenty of baby omega-3 formula, which mostly contain DHA.
You talked about the importance of the family meal time. How important is it for our babies to observe our eating habits?
So actually, from when a baby is born, they will be looking at you and observing what you're doing. So generally babies do see, particularly when their mums are eating, they often start to cry then. But actually it's useful for them to see and smell what you're eating and be exposed to it. And then as they get older, it's really helpful if you can sit them with you at the table or sit with them when they're eating and have something to eat yourself. What they're doing is they're watching the way you eat, but they're also seeing what you're eating and will develop an interest. So often children prefer to eat from their parents' plates or even their siblings' plates, and that gives them an extra exposure to a different flavour that they might not otherwise have.
Great, so I'll have to tell my husband that he'll need to share his plate now.
Yes.
So we talked about the sensory experience of baby-led weaning specifically. Is there any developmental value in babies playing with their own food?
So generally babies are not going to be tidy eaters because they're just learning how to actually move a spoon to their mouth, and also they're learning about the different textures of food as well. And these are really important exposures for their nervous system. And so what I say is to not worry as much as you can about the mess. And actually the messier the better. So if they can get both of their hands into the bowl, that's actually a good thing. So don't see it as, oh no, I'm going to have to clear up. Obviously we would have to clear up, but that's a good thing for them going forward. So they're more likely to then eat a wide range of foods. They're more likely to accept different foods, particularly finger foods in their hands.
So it's kind of a form of play, if anything,
yeah.
as well. Great. So we've talked a lot about quantities of different types of food in the diet. How can I know whether my baby is eating too little or perhaps too much?
So it's a really good question, and it's one that lots of parents do worry about. What we would say is that when babies are very young, so when they're first feeding, that's when they're establishing their appetite and also their appetite signals. So this is why we talk about babies demand feeding. So when they're hungry, they generally do have a particular cry which indicates that they're hungry. And we kind of get an idea of how much they're having in a day. To go against those appetite signals means that you might be overriding their natural ability to say, my tummy is full. And we want to avoid that as much as possible. So if a baby then turns their head or just closes their mouth and doesn't allow any more food in, that's usually a signal that that's it, they've had enough, and we should try not to override it. Even though it's our natural instinct to say, oh, they need to finish this bowl or they need to finish this bottle, it's probably better to wait and see then if they're hungry a bit later.
So can there be times where your baby makes those same signals, but it's not because they're full?
So obviously babies cry for lots of different reasons. Generally people are aware of that baby hasn't fed for a certain number of hours, though that is likely to be that they need a feed. And it's usually just a asking for food rather than a very distressed cry. Although if you leave it too long, that can become distressed. And it's really about tuning into your baby because they will make other signs that they're hungry. So they might start to root, which is when they feel something on their mouth and then they start to try and suckle on something. So that's an indication that they might be hungry as well. So it's not just the cry, but that's something that you develop as you get to know your baby. And really it's a case of understanding when they're hungry, but also understanding when they seem to be full and satisfied.
And going with the quantity of food, let's talk about the baby's weight. Should I be concerned about how much weight my baby is gaining or losing? And how do I know as a first-time parent when to worry?
So we do have the opportunity to have our babies weighed, and that's something that's actually useful and helpful to monitor their weight, particularly in those first few months where you're not necessarily sure how much they're feeding. And so if that shows that their weight is going off the line that we would hope them to be on, then that would be an indication to say there may be an issue and that it needs to be checked. Generally, babies do tend to stay on a similar line of growth, particularly in the first year. So that would be your guidance to have your baby weighed at least every couple of weeks. And then as they grow older, you can decrease the frequency of that. And that will just give you an idea of how well they are thriving, is what we call it.
And is there a particular frequency that our babies should be weighed at?
So as I said, initially we would want to do it maybe weekly or every other week, and then that tails off, particularly as they get past a few months of age.
So we've talked a lot about having a complete diet and some of the supplements that you might need to take in your diet also. But what are the signs of nutritional deficiency that we could be looking out for?
So it is difficult to know whether a baby has particular nutritional deficiencies, but I would say that if you're fully breastfeeding a baby up to 6 months and you have a fairly balanced diet, it's very unlikely that they'll have a nutritional deficiency. It's after that, when they start to wean, that possibly they could be low, particularly in certain things like iron. And then vitamin D is a slightly different subject because we don't get that through our diet generally. So we have to think about that separately.
That's really helpful, thank you. And we talked about this briefly when you mentioned colic and how eating affects other functions of a baby.
Yeah.
How can the diet influence the sleeping pattern?
So babies can be woken by different feelings or symptoms in their tummy. So perhaps if a baby's constipated, that could wake them up. If they've got extra wind, that could wake them up. And generally you might see if they're in pain, they might be drawing their legs in. So that is one of the signs that it's possibly their tummy that's waking them up. And I find that parents tend to know that it is a symptom like a pain that's causing that. And so what we would think about is how can we reduce those symptoms at night? So is it something that's coming into their diet or into the mum's diet that is affecting them? Or do we want to give them something like a Gaviscon if it's a type of reflux that's causing that as well.
And do you encourage parents to keep a food diary or anything like that to monitor what their babies are getting?
So if they have a concern, then yes. Generally, parents might have just an awareness of, I'm giving a range of different foods over the course of, say, a month. I wouldn't say you have to note down everything that your child is eating, but if you had a worry, like a symptom that you're worrying about, then it might be related to food, so it would be useful to do that for a short, maybe 2 weeks.
Thank you so much, Venita. That's been so helpful. I've learnt so much and I feel definitely more prepared to be whipping up those meals for my little one when they arrive.
That's great. You're very welcome.
So I'm going to be asking you a few questions about you, and I'd like you to answer them as quickly as possible.
Okay.
Are you ready?
Yes.
Okay, so the first one is there a hidden talent that nobody else knows about you?
Not so hidden, but I do like to sing, so I'm a singer. But
Me too.
I don't do that in my work, so probably hidden.
And what do you like to sing?
Well, I like singing in a choir, and also we sing Indian songs as well.
Oh, great. Okay, next question. If you were a boxer, what would your entrance song be?
So I'm a big Whitney Houston fan, and so I Want to Dance with Somebody is my favourite song, so I think I'll choose that.
That's a very good choice. And if you had a superpower, what would it be and why?
It could be an unusual superpower, but I feel like if I could affect people and make them be kinder, that would be a great thing to do. So even just by thinking about someone, make them feel kinder to someone else.
That's a really nice one to choose and not one we had before.
Cool.
So we're going to do a quick fire round now.
Okay.
So I'm going to ask you a this or that question, and I want you to say what comes to your mind first.
Sure.
So, early bird or night owl?
Early bird.
Dine in or dine out?
Dine out.
Full fat, semi-skimmed or skimmed milk?
Full fat.
And what's your favourite ice cream flavour?
Pistachio.
Oh, that's been a popular choice and it's my favourite too.
Oh, lovely.
And lastly, describe yourself in 3 words.
So I've been told that I'm calm. I have a cheeky, funny side to me, so make people laugh. And I have a superpower of keeping children calm as well. So that is part of my description, I think.
Great, I was going to say all perfect qualities to be a paediatrician.
Yeah.
Okay, well done. Thank you so much for those answers. Thank you so much, Venita. I feel so much more prepared about whipping up some of those meals for my little one.
Oh, that's good.
And I hope you'll join us again soon.
Absolutely.
And that's a wrap for today's episode of the Uni podcast. We hope that's answered some of your most pressing questions about baby nutrition. Remember to sign up to unii.com to complete Venita's baby nutrition journey. Thanks for learning with us, and we wish you all the best.